Well, a new attitude along with some creative financing is helping some Oklahoma towns save their local hospitals. Our Alisa Hines visited Drumright, where local residents are investing in a healthier future.
When the Drumright Hospital closed in 2001, residents knew without a medical facility, they would suffer both a medical and a business hardship. So they decided to do something about it. Drumright's business community took a big hit when the hospital closed.
I mean, we were losing people right and left after the hospital closed.
Danny Cooper is the former chair of Drumright's Healthcare Authority and says a community hospital makes a difference.
When you're trying to grow a community, schools and healthcare is two of the major issues, you know. Local residents agree. So much so, they voted to open a new critical access hospital. Jim Martin is the chair of Drumright's Healthcare Authority.
Critical access is a designation granted by Medicare that dictates your reimbursement levels. And by being a critical access hospital in a rural community, as long as our payer mix is right, the ratio of Medicare patients versus Medicaid, self-pay, and insurance, we can recoup our fixed costs for the operation of the hospital from a Medicare reimbursement.
No, I'm not.
For longtime Drumright resident Betty Cass, having a local hospital is preferable.
I'm not one to like to get out and go a long ways just to go see a doctor. If I can have one at home, I'd much rather have one, you know, where I'm at.
And in smaller communities, doctors get to know their patients very well. Just ask doctor-in-residence Doug Brant.
It's kind of like the movie Doc Hollywood. The people around town get to know who you are, and it's a really neat experience.
One Dr. Brant takes very seriously.
I've practiced in Oklahoma City and then out here in the rural community, and the real, I think, advantage that rural medicine has, we all live in the same community, small community, and there's a level of accountability. You know, people that I take care of here, I'm going to run into their family member down at the grocery store or at the bank. And so there is a whole lot more accountability. You know, I want those patients to be taken care of just like I would my family.
And according to hospital administrator Darrel Morris, in this rural hospital, you're not just a number.
I think we've done some things here and made arrangements with people that we know that maybe couldn't get care at other places.
Care given using state-of-the-art equipment. Ron Dyer serves on the hospital's foundation and says that equipment is what is helping make the hospital successful.
We've been able to bring to rural Oklahoma equipment and procedures that are not common to a small community in Creek County.
Technology that's creating a homegrown workforce.
Central Tech's been in Drumright now for over 40 years, so in health, our health programs have been a very vital part of our offerings. So it's been a great relationship to have this close a proximity to the hospital and our healthcare facilities.
And is also helping the community grow.
I think that we could directly attribute some of our folks that have chosen to locate here or chosen to remain here simply because we have adequate health care available locally.
With only 15 beds, the Drumright Hospital is a shining example of how a small hospital can not only survive, but prosper in a small community.
I think we've exceeded everybody's expectations.
It's never a joy to go to the hospital, but if I had to go somewhere, I think I'd just soon come right here. This is my #1 choice.
A choice that's easier to make because it's right at home. Now, they not only take care of their patients, but they take care of their patients' families as well by placing comfortable recliners in each of the rooms.
So, Lisa, it sounds like this hospital, while small, is becoming quite popular.
That's right, Rob. Not only do people come from surrounding communities, but so far, the farthest patient has traveled all the way from Branson, Missouri, mainly because of the state-of-the-art equipment and the quality of care.
And let's talk a little bit about that state-of-the-art of equipment. They use something called telemedicine. Explain to me how that works.
Well, they don't have a radiologist on staff, but they do have an X-ray machine that they can take the image and email it to a radiologist in Edmond, who can then give them the results in about 30 minutes, giving big city care in a small town setting.
Well, thank you, Lisa. Well, it certainly sounds like Drumright is becoming a true example for other parts of our state.